Let us now go to diagnosis through the teeth. The topic is teeth grinding. Although it is only a tiny part of the human body, the teeth are an important organ. If something goes wrong with the teeth, it does not mean that the teeth alone are diseased. There may also be problems with the viscera. Observing the teeth can help people get a rough idea of the status of the Zangfu organs. Teeth have a close relationship with the viscera. The Meridians chapter in the Inner Canon of the Yellow Emperor points out that teeth are not only inseparable from the stomach and large intestine, but are also closely connected to the other internal organs in the human body. The Inner Canon of the Yellow Emperor not only affirmed the physiological connection between the teeth and the kidney qi, the essence and the Yangming meridian of the hand and foot, but it has also spotted the pathological relationship between the teeth and the viscera. For example, a toothache is caused by stomach fire, and the loosening or loss of teeth is due to a kidney deficiency. It is not hard, therefore, to see how a single tooth can reflect the health of a body's internal organs. Based on TCM and modern anatomy, the teeth are classified into incisors, canines, premolars, and molars. The differences in shape and function of the teeth dictate the different internal organs pertaining to the teeth in different locations. The upper incisor connects to the heart, the lower incisor to the kidneys, the upper canine and premolar to the stomach, the lower canine and premolar to the spleen, the upper left molar to the gallbladder, the lower left molar to the liver, the upper right molar to the large intestine, and the lower right molar to the lungs. Human teeth can reflect what is going on with the internal organs in the human body. Teeth are a relatively independent part of the human body, so when a tooth aches, the pathological change of an internal organ can be directly determined from that tooth alone. Here we can see the distribution of teeth and the corresponding viscera. Number 1 is the upper incisor that connects to the heart. Number 2 is a lower incisor that connects to the kidneys. Number 3 is the upper canine and premolar that connect to the stomach. Number 4 is the lower canine and premolar that connect to the spleen. Number 5 is the upper left molar that connects to the gallbladder. Number 6 is the lower left molar that connects to the liver. Number 7 is the upper right molar that connects to the large intestine. And number 8 is the lower right molar that connects to the lungs. Teeth grinding. The upper and lower teeth grind against each other and make a clicking sound. Teeth grinding at night can cause excessive wear of children's teeth and a dysfunction of the temporomandibular joints. There are several factors contributing to teeth grinding. There are emotional factors that include excessive fatigue and overstress. Systemic factors include parasite infection, gastrointestinal disorders, and malnutrition. It could also be abnormal occlusion between upper and lower teeth, or abnormal occlusion leading to a dysfunction of the temporomandibular joints. Thank you so much for your attention.
Interviewing. Headaches. Headaches due to qi conditions can arise when there have been periods of physical inactivity, the lack of physical movement resulting in qi stagnation. A headache that comes from a person sleeping too much is due to qi or phlegm stagnation. Damp or humid weather is detrimental when there is dampness and phlegm, and it can trigger a heavy or throbbing headache. Headaches associated with a person's emotional condition are usually related to liver qi imbalances. Headaches arising after sex are seen in kidney shu conditions or when there is ascending liver yang. A headache that is provoked by eating can be due to food stagnation, phlegm, dampness, or stomach heat. If the headache is relieved by eating, there will be qi shu. Liver qi can have a tendency to stagnate in the premenstrual period. Headaches that have a pattern of occurring in this period are therefore probably due to ascending liver yang or liver qi stagnation. Menstrual bleeding will exacerbate a condition of blood deficiency. If there's a tendency for the headache to occur immediately after or during the menstrual bleeding, it can indicate that there is liver blood stagnation. In this chart, we see types of headaches. So if the observation is an acute headache, The significance is there's invasion of exogenous qi. If it is a unilateral headache, there is ascending liver yang or liver fire. It may be also due to liver wind. If the headache is temporal, the significance is ascending liver yang or liver fire. It may also be due to liver wind. If the headache is at the top of the head, the significance is there may be a liver imbalance or blood or qi stagnation. If the headache is behind the eyes, the significance is liver blood deficiency or ascending liver yang. If the headache is frontal, then there may be a stomach imbalance, both deficiency and excess, or phlegm dampness. If the headache is in the occipital region, then the significance is the headache is acute. It will usually be wind cold. Or if the headache is chronic, it can be a kidney imbalance manifesting in the urinary bladder channel, or it can also be due to muscular tension and tightness resulting from either local stagnations of qi and blood or due to liver qi stagnation. If the headache is in the entire head, it may also be an invasion of wind cold if the head is acute. If the headache is acute, otherwise it is usually in the deficiency patterns of imbalance. If the headache is localized on specific spots on the head, then it may be due to blood stagnation. If it is an acute headache, then it's an excess condition. If it is a dull, nagging headache, then it is a deficiency condition. If it is a throbbing headache, there may be ascending liver yang or liver fire, wind heat, or phlegm. If it is a heavy headache, then this could be phlegm dampness. If stabbing or sharp pain, it may be a blood stagnation. If it is arising from a lack of physical activity, then this could be liver qi stagnation. If the headache occurs when the person is tired or overworked, then it could be a depression. If the headache is arising from weather changes and humid weather, then this could be phlegm dampness. If it is triggered by stress and emotional influences, this could mean liver imbalances. If it is triggered by sex, it could be kidney deficiency or ascending liver yang. If the headache is due to premenstrual headache, it's a premenstrual headache. This can be liver imbalances. If it is a headache after menstruation, then this could be blood deficiency. Thank you for your attention.
Let's proceed to pain discrimination with abdominal pain, back pain, lumbar pain, limbs pain, and generalized pain. So let's start with abdominal pain. Its characteristics, the pattern discrimination, and the proposed points. So if abdominal pain is characterized with pain increasing with compression, its pattern is excess pattern, cold, it can be cold, heat, qi, blood, food, or parasite stagnation. So the proposed points are spleen 5, REN 12, and stomach 25. If the pain is relieved with compression, it's a deficiency pattern. It could be qi, blood, yang, or yin deficiency. And the proposed points are spleen 6, stomach 36, and stomach 25. If the pain is persistent in the abdomen and there are periods of exacerbation, there is abdominal distension, and there is vomiting and nausea, it could indicate intestinal obstruction. And the proposed points are stomach 42, stomach 39, REN 12, and pericardium 6. If the pain is generalized abdominal pain and pain increases with pressure and sudden decompression or a rebound tenderness, it could mean intestinal perforation and peritonitis, or there could be sepsis. The proposed points are the appendicitis point, lung Wei Shi, and Liang Qi, and spleen 14. If the abdominal pain is sudden and severe, it's located in the flanks and pelvic or close to the navel, it could mean urinary lithiasis. The proposed points are spleen 8, stomach 28, and GB 25. Now let's proceed to back pain. If back pain is characterized with being incapable of bending or facing upward, it could mean cold and damp stagnation or lesion of the Dymai channel. The proposed points are SI3 and bladder 62. If there is back pain that reaches the neck, it could mean wind cold attacks and of the Taiyang channel. The proposed points are GB14, bladder 12, and SI3. If there is back and shoulder pain, it could mean cold and damp stagnation, channel cheese blockage. The proposed points are gallbladder 20, DO 14, and GB 21. Now let's go to lumbar pain. If there's lumbar cold pain, which worsens with humidity, this could mean cold and damp stagnation. And the proposed points here would be bladder 60 and bladder 22. If there is sore pain in the lumbar area, this could mean kidney deficiency. And the proposed points are kidney 6, lung 7, and bladder 23. If there is severe lumbar pain that irradiates to the lower limbs, this could mean collateral blood stagnation, lumbar vertebra pathology. The proposed points are bladder 25 and GB 34. If there is lumbar pain that reaches the abdomen, this pattern is of Dymai or the belt channel lesion. The proposed points are GB41, Sanjal 5, and GB26. If there is intense pain that irradiates to the pelvic area and there is hematuria, this could mean urinary lithiasis. And the proposed points are stomach 28, spleen 9, kidney 5, and GB 25. Now let's go to limbs pain. If there is tendinomuscular and joints pain, it could mean B syndrome, could be wind, cold, and association. The proposed points are GB 34 and GB 30. If there is ankle, leg, or knee pain, this could mean spleen, stomach chi deficiency, or kidney deficiency. The proposed points are spleen 6, spleen 5, and kidney 10. Now let's move on to generalized pain. If the pain is of recent disease, this could mean an excess pattern of wind, cold, damp invasion, or epidemic toxic damp heat. The proposed points are DO 14, bladder 62, and SI3. If the pain is of chronic disease, it means deficiency pattern of qi and blood or lack of proper nutrition. And lung 7. Thank you for your attention.
Differential diagnosis for dysmenorrhea. Let's start with the Western differentiation. There are two types of dysmenorrhea, primary and secondary. Primary dysmenorrhea is characterized by menstrual pain in otherwise healthy women. The pain is unrelated to problems with specific organs. It can stem from stress anxiety, in which the dysmenorrhea is associated with feelings of frustration, anger and anxiety, muscle tension, twitching or trembling, sweating, dry mouth, and rapid breathing. The primary dysmenorrhea could also stem from premenstrual syndrome, in which the patient is irritable, bad-tempered, depressed, tearful, with headache, breast tenderness, water retention, weight gain, poor sleep, poor concentration, backache, acne flare-ups, constipation or diarrhea, and food cravings. Secondary dysmenorrhea is pain coming from a structural abnormality. It can stem from endometriosis, in which the periods are increasingly painful with pelvic cramps before and or during period, clotted blood, lower backache, painful sexual intercourse, pain with bowel movements, premenstrual spotting, and infertility. Secondary dysmenorrhea, stemming from pelvic inflammatory disease, is characterized by painful periods, vaginal discharge with abnormal color, consistency, and odor, fever and chills, painful sexual intercourse, bleeding following intercourse, low backache, fatigue, frequent and painful urination. The dysmenorrhea could also stem from fibroids, in which there will be pelvic cramping or pain with periods, sensation of fullness or pressure in the lower abdomen, flatulence, frequent urination, heavy menstrual bleeding with clots, sudden and severe pain. The dysmenorrhea could also stem from ovarian cysts, and this will be characterized by pelvic pain before, during, or after a period, pain with sexual intercourse, abnormal uterine bleeding, abnormal bloating, or distension. Now let's go to the Chinese differentiation for dysmenorrhea. Diagnosis, according to nature of pain, there will be, if it is due to Qi stagnation and blood stasis, there will be lower abdominal distension or pain 1 to 2 days before the period, worse on pressure. If the dysmenorrhea is secondary to Qi stagnation, there will be distension, cramping, worse from stress. Dysmenorrhea secondary to blood stasis is characterized by a fixed lancinating pain. If there is stagnation of cold dump, as that results in dysmenorrhea, there will be pain in the abdomen, twisting, desires warmth, and resist pressure. For dump heat dysmenorrhea, there is lower abdominal tightness, distension, pain, resisting pressure, and worse towards period. Liver fire dysmenorrhea is characterized by abdominal aching or pain, distension, pain in the flanks. Qi blood deficiency diarrhea, dysmenorrhea, is characterized by slight lower abdominal heavy aching or pain. If it is this deficiency, dysmenorrhea, there is insidious lower abdominal pain with menstruation. Dysmenorrhea due to blood stasis, which is likely endometriosis, there will be poking pain that is worse on intercourse. Now let's differentiate dysmenorrhea according to the tongue and pulse. The tongue is purplish and dark with static spots or macules, pulse deep wiry or deep choppy. This is Qi stagnation or blood stasis. If the tongue is cyanotic and purple with glossy moisture and the pulse is deep, slow, forceful, or deep tight pulse, then the dysmenorrhea is due to stagnation of cold damp. If the tongue looks yellow and slimy, with a slimy tongue coating with a wiry rapid pulse, that's damp heat. A crimson red tongue with scanty coating with wiry fine rapid pulse is dysmenorrhea due to liver fire. Pale tongue, thin white coating, teeth marks, empty fine pulse is dysmenorrhea due to Qi and blood deficiency. Pale moist tongue, deep relaxed forceless pulse is empty cold dysmenorrhea. Dry red peeled tongue, wiry fine rapid pulse is empty heat dysmenorrhea. Now let's differentiate the different patterns for the Zhangfu patterns for dysmenorrhea. For the excess patterns, we have Qi stagnation, blood stasis, liver fire blazing, damp heat, damp cold, and the deficiency patterns are empty heat or empty cold in the uterus, liver, kidney, and deficiency, Qi and blood deficiency. Thank you for your attention.
Now let's continue our discussion about relationships among Zhang viscera, specifically the heart and spleen. The heart controls the blood vessels and the spleen controls transportation and blood flow. The relationship between the heart and spleen is seen most importantly in the formation and circulation of blood. The formation of blood. The spleen's ability to transport and distribute the essential nutritive substances and its ability to generate blood both depend upon heart yang's warming action for completion. That is, the fire element generates the earth element. When spleen qi is plentiful, the source of blood is abundant. The heart is well nourished and the heart's functions are normal. In pathology, deficiency of spleen qi can lead to deficiency of heart blood. Deficiency of heart blood can diminish the spleen's nourishment. This eventually results in deficiency of both the heart and the spleen, manifested by palpitations of the heart, insomnia, excessive dreaming, poor appetite, and lassitude. Treatment usually involves the method of strengthening the heart and augmenting the spleen. Second, about the circulation of blood. The circulation of blood through the vessels depends not only upon heart qi for propelling force, but also on the spleen in keeping the blood flowing within the vessels. In pathology, failure of spleen in managing blood flow can bring about erratic blood circulation and excessive consumption of heart blood. Such symptoms as nosebleed, blood in feces, vaginal bleeding, and subcutaneous bleeding can result. Deficiency of heart qi and concomitant loss of propelling force can weaken the spleen's ability to control blood flow. This can result in bleeding or blood stasis. In this diagram, we see the relationship between the heart and the spleen. So the heart dominates the blood in blood circulation. With heart yang, it promotes blood formation. With the spleen, which generates and makes and also partakes in blood formation, this commands blood circulation for the entire body. Thank you for your attention.
Let's now proceed to diagnosis according to Zhang Fu organ patterns with urinary bladder blood stagnation. Urinary bladder blood stagnation. This is a chronic pattern that can arise from chronic patterns of imbalance in the urinary bladder. Chronic conditions of dampness can impede the movement of qi, which can result in the stagnation of blood over time. Heat can condense blood, so it becomes sticky and starts to stagnate. Stagnation of liver qi can affect the qi mechanism in the urinary bladder, causing a stagnation of qi. When qi stagnates, it can fail to circulate blood. The stagnation of blood can also arise independently of other patterns, for example, after surgery in the lower jaw. Now let's look into its etiology. Blood stagnation can be the result of physical trauma, surgery, or medical investigations. Emotional issues such as frustration, irritation, repressed emotions, and stress can lead to the stagnation of liver qi, which can affect the movement of qi in the urinary bladder. Over time, this can lead to stagnation of blood. Heat that boils blood so it becomes sticky and stagnates can be due to emotional issues, creating a stagnation of qi that generates heat, or dietary imbalances that lead to generation of heat or dampness. The symptoms and signs. Difficult or painful urination, inhibited urinary flow, incomplete voiding of the urinary bladder, there can be blood in the urine, tightness, pain, or distension in the area above the pubic bone, small visible purple blood vessels or spider nevi, purple or dark spots on the root of the tongue, swollen purple sublingual veins, the choppy or wiry pulse, especially in the left shore position. Key symptoms: inhibited or difficult urination, distension in the lower jaw. Treatment principle: invigorate blood in the urinary bladder. For the acupuncture points, you can choose from REN 3, spleen 6, spleen 10, stomach 28, bladder 17, bladder 28, and bladder 32. A relevant advice for this patient with this symptom will depend on the underlying pattern of imbalance. If there is heat or dampness, the patient should avoid consuming food and beverages that generate this. Any underlying emotional issues or stress should be addressed. Physical exercise and movement will help to circulate qi and blood. It can be beneficial if the exercises focus on circulating qi in the lower jaw. Hula hoops, sit-ups, and rowing machines can help to do this. Massaging on the lower jaw is also recommended. Urinary bladder blood stagnation can be caused by the following patterns of imbalance: urinary bladder damp heat, liver qi stagnation, and urinary bladder qi stagnation. In turn, it can result to urinary bladder stones. Thank you for your attention.
Endogenous pathogenic evils, and for today we will discuss endogenous cold. Endogenous cold arises within the body when the functions of the Zangfu viscera are inhibited or have declined, or the in-cold evil permeates the body as a result of decline of yang qi and loss of its warming and transforming actions. This situation is mainly due to insufficient endowment of innate constitution, or inadequate acquired nutrition, or sustained depletion of yang qi in a chronic illness. Whichever the cause may be, yang becomes deficient and excessive. Thus, endogenous cold is also known as internally generated deficiency cold. Clinically, endogenous cold presents in one of two ways. First, yang decline and yin ascendancy. Excessive yin induces internal coldness and decline of yang qi of the internal organs. This in turn leads to failure to warm the blood vessels, the interstitial spaces, the sinews, and the muscles. Clinically, the symptoms are those of contraction tautness, such as a pallid complexion, aversion to cold, and desire for warmth, lying in a curled or fetal position, and cold body and limbs. Alternately, all the limbs are cold, there is no sweating, or there is circumscribed local pain and cold. The pathological changes of endogenous cold are mainly related to the deficiency of spleen yang and kidney yang. For kidney yang is the root of the entire body's yang qi and supplies warmth to all the visceral organs and body structures. When spleen and kidney yang is deficient and its warming action missing, it is especially easy for deficiency cold to appear. In this process, the decline of kidney yang is the key. Thus, the plain question states, all cold syndromes are marked by contraction tautness, and they all belong to the kidney. Second way is the debility of yang qi. Debility of yang qi compromises qi transformation and causes the failure to restrain yin. The metabolic processes are in turn impeded or stopped. The products of yin cold then accumulate, leading to dampness, phlegm, and rheum. The symptoms are usually polyuria of clear urine, thin and clear saliva, and nasal discharge, or watery diarrhea or edema. Thank you very much for your attention.
Let us now go to pathology of qi and emotional problems. The topic is effects on internal organs. Here we can see a list of emotional problems and what internal organs it affects. Like anger, including frustration and resentment, affects the liver. Joy affects the heart. Worry affects the lungs and spleen. Pensiveness affects the spleen. Sadness and grief affect the lungs and heart. Fear affects the kidneys. Shock affects the kidneys and heart. Love affects the heart. Craving affects the heart. Guilt affects the kidneys and heart. Shame affects the heart and spleen. However, the effect of each emotion on a relevant organ should not be interpreted too restrictively. There are passages from the Yellow Emperor's Classic that attribute the effect of emotions to organs other than the ones just mentioned. For example, the spiritual axis in chapter 28 says, worry and pensiveness agitate the heart. The simple questions in chapter 39 says, sadness agitates the heart. Indeed, the whole chapter 216 of the Classic of Categories is dedicated to the discussion of the influence of each emotion on groups of organs. The Classic of Categories says the 5 emotions interact with each other in causing disease. For example, excess joy affects the heart, but it may also affect the lungs and injure the corporeal soul or the Po. Excess joy derives from the heart but moves to the lungs. Anger affects the liver but also the gallbladder. Liver and gallbladder are interiorly and exteriorly related, and when liver qi is excessive, it affects the gallbladder. When there is anger, blood rushes upwards and qi downwards, and this harasses the heart. Sometimes anger affects the kidneys and it injures the willpower. Hence, anger can affect the liver, gallbladder, heart, and kidneys. Pensiveness pertains to the spleen, but it also affects the heart. The heart is the mother of the spleen, so when the qi of the mother does not move freely, it affects the child, and therefore both spleen and heart are affected by pensiveness. Worry pertains to the lungs, but it also affects the heart. Worry makes qi rise and can affect the liver. The liver becomes overactive and it invades the spleen. The spleen is then affected by worry, and this injures the intellect, or the yi. Hence, worry affects the lungs, heart, liver, and spleen. Thus, excess joy, anger, pensiveness, and worry affect the following organs. Excess joy affect the heart and the lungs. Anger, the liver, gallbladder, heart, and kidneys. Pensiveness will affect the spleen and the heart. Worry affects the lungs, heart, liver, and spleen, and fear the kidneys, heart, liver, spleen, and stomach. The effect of an emotion on an organ depends also on other circumstances and on whether the emotion is manifested or repressed. For example, anger that is expressed affects the liver, causing liver yang rising, but anger that is repressed also affects the heart. If one gets angry at mealtimes, as sadly often happens in certain families, the anger will affect the stomach, and this will be manifested with a wiry quality on the right middle position of the pulse. The effect of an emotion will also depend on the constitutional trait of a person. For example, if a person has a tendency to a constitutional weakness of the heart, manifested with a midline crack on the tongue extending all the way to the tip, fear will affect the heart rather than the kidneys. Furthermore, all emotions, besides affecting the relevant organ, directly affect the heart indirectly because the heart houses the mind. It alone, being responsible for consciousness and cognition, can recognize and feel the effect of emotional tension. Fei Bo-xiong put it very clearly when he said that the 7 emotions injure the 5 yin organs selectively, but they all affect the heart. Joy injures the heart. Anger injures the liver cannot recognize anger, but the heart can. Hence, it affects both liver and heart. Worry injures the lungs cannot recognize it, but the heart can. Hence, it affects both lungs and heart. Pensiveness injures the spleen cannot recognize it, but the heart can. Hence, it affects both spleen and heart. Yu Chang in Principles of Medical Practice says, worry agitates the heart and has repercussions on the lungs. Pensiveness agitates the heart and has repercussions on the spleen. Anger agitates the heart and has repercussions on the liver, and fear agitates the heart and has repercussions on the kidneys. Therefore, all the 5 emotions, including joy, affect the heart. Chapter 28 of the Spiritual Axis also says that all emotions affect the heart. The heart is the master of the 5 yin and 6 yang organs. Sadness, shock, and worry agitate the heart. When the heart is agitated, the 5 yin and 6 yang organs are shaken. Chinese writing clearly bears out the idea that all emotions affect the heart because the characters for all 7 emotions are based on the heart radical. This is probably the most important aspect of the heart functions and the main reason for it being compared to the monarch. The way that all emotions afflict the heart also explains why a red tip of the tongue indicate heart heat. It's so commonly seen even in emotional problems related to other organs. The main effects of emotional stress are qi stagnation, blood stasis, heart or fire, and dampness or phlegm. Thank you so much for your attention.